The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we're getting healthy with Solvera Health. We're talking about pharmacy, and we have a registered pharmacist with us here today, Barb Barnewolt. Thank you so much for joining us.
Thank you for having me.
Yes, of course, we've talked about at Solvera, everything is under one roof, everything is all right there, so convenient, including pharmacy.
Yes.
And you're talking to us a little bit about that. So you've been there from the very start. What brought you to Solvera?
I like the concept of it. I had worked in other clinic pharmacies throughout my career. I mainly have a strong retail background and also did some consulting early on, with long-term care.
Okay.
And then worked for a closed-door pharmacy with mental health. So it's fabulous.
Yeah. So you got a lot. You've been in a lot of different areas here.
Correct.
Seen a lot of different things.
Very diverse background.
Yeah, and you know that this is definitely, I think, what people need. This all-inclusive, right there, everything in one spot. So tell us what the benefits are of having that pharmacist right there on site after a patient talks to the doctor.
Right. If there's an issue with the prescription, we can hopefully get it rectified in a timely manner, all along keeping the patient informed with what's going on, the status of it. Ask them politely to sit up front while we talk to the provider. It could be an insurance issue. The drug may not be on the formulary. It might be a drug shortage. The provider might bring the patient to the pharmacy counter, and we'll finish up the prescription. Maybe they need to finish registration, check out, and we can always send them a text message when the prescription is ready. It's fabulous. We also deliver.
Yes,
so that's nice. Free delivery.
Free delivery, very nice.
Yes, within the Peoria community.
Yep.
Yeah.
Some other services you do, you have immunizations, you're doing tell us what else you guys do
I
over there.
actually just gave an immunization before we came over here.
Very good,
so it's great. Yes. If the physician deems that the patient needs immunization, we can get that taken care of right while they're still there within the clinic. We do adherence packaging, which is wonderful.
Yes, tell us about that, what that is.
So it's 1 week of medication in a package that organizes it, and we package we can do up to 3 months, 90 days. Generally, it's 4 weeks that we do. So we put the patients on a cycle with our computer system, and we sync the meds so that they can all come due on one day, so less trip to the pharmacy. Helps people remember, therefore staying on their medications, decrease hospitalizations, decrease finances. So it's a really good benefit.
And they can just something they can ask for.
Yes.
You guys can do
that.
Okay. Yeah. And I'm sure a lot of times too, your doctors and everyone kind of knows your patients a little bit more, and maybe even will say to you like, this patient may require benefit from
Right.
And that's what's so different about you guys too, is that there is that connection between doctor and pharmacist.
It's a collaboration and positive outcome. That's what we are there to achieve.
Yeah, I mean, a lot of times, your traditional setting, the patient leaves, they have to go drop off the prescription, they come back, you have to come back, and there's so much, and questions are forgotten, things are forgotten. Yeah, so it's nice to have all of that right in one spot.
And we have a lot of systems in place, check stations, mechanisms to get a message to the provider if something doesn't sound right.
Yep. Yeah. Catching it right there at the very beginning. All right, well, we love that, and we love what you guys are doing over there. Barb, thank you so much. And of course, you can learn more about Solvera Health and all that they do at solverahealth.com. Barb, again, thank you so much for joining us today.
You're welcome. Thank you.
More coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.